afternoon and welcome to the Human Biography Podcast. On today's episode, I have Jason from HiBoop. Welcome to the podcast.
Thank you so much. Happy to be here.
It's
a beautiful day.
Yeah, it is a beautiful day. I want to first talk to you about your work. Tell me a bit about yourself and what you're working on right now.
So HiBoop is it's a new platform to give care providers accelerated access to a broader assessment of what's going on in somebody's life.
Wow.
Because we know and they know that it's currently quite flawed. Some of its capacity, some of it is a singular approach to mental health, right? You're showing up somewhere at some walk-in clinic because somebody thinks you might be depressed or you might be self-aware,
right.
and you get your 22 minutes with the doctor.
Maybe.
Yeah. Or you're. So it's flawed, and just based on my own personal journey, just figured there's got to be a better way. This is a global thing. It's not just a Canadian thing.
And what are the metrics that you're measuring and some of the data that you're taking out from this, and how does it work?
So the metrics are used by the care providers or doctors or
whoever's treating.
Whomever. What we do, which is there's a lack of it, is if you have an amazing doctor or therapist, they're going to do this. The sad reality is most people don't. So it's tracking from assessment.
Yeah.
We don't do diagnosis. That's for the professionals to do. To some plan that they're going to build. If it's trauma, you're going to do some trauma therapy. If it's this, you're going to do this. And then tracking the results over time and then actually allowing the individual to port that over to their new care provider.
Give me a framework of what the assessment looks like and how that's taken.
It's very simple. So if you go into the clinic, then you're going to get a clipboard and piece of paper, right? They're going to do a preliminary one.
Absolutely.
Everybody's kind of done one.
Yeah.
Right, you do that one, that goes in a filing cabinet, and they're like, you're not like, this
Maybe
isn't what it is,
let's
look at something else.
Yeah.
So it is kind of psychometric based. So it's the questions based on the existing science, which is not perfect.
Yes.
But what we try to do is, instead of that singular approach, is to start to connect the dots. Because most times with mental health, the most visible thing, I mean, even with physical health, is not the root. So we're not
That's
fixing
right.
it, right?
Right.
So and more so in mental health. So what we try to do is connect the dots and just say like,
amazing.
Okay, we know sleep disorders are associated with this. We
Yeah.
know that substance use disorders are associated with this,
Yes.
and so forth and so on. So what we try to do is use all of the information that we can access and the data and evolve it to be, somewhat of a more just advanced version of what we're doing with it.
And then would the care professional receive a report, or how do they get to that? Yeah.
Yeah. They'll get a full report,
Yeah.
and they can set up their own check-in process. So if you take like one single disorder, let's pick PTSD.
Sure.
Here's the things. All right, when you're diagnosed with a disorder.
Yes.
I have a lot of them. Sorry.
I'm sure we all do. Actually, we probably don't. We don't know, and we don't know.
They're like, I'm a little bit ADHD or I'm a bit OCD today or something. But when you're diagnosed, like that's an in-depth process. So
Yes.
what is the efficacy of the treatment? It could be pharmaceutical. It could be. This is not to judge care providers.
No, of course not.
Like, how is this working, and how does this work with this cohort?
Specific person as well.
Yeah. So if you're male in your 40s or you're female in your 20s, like these pharmaceuticals or these cognitive therapies or these things work really well, but they're not working really well for the 60-year-old.
That's right.
Yeah.
And when you first created this opportunity for yourself, what did you see was missing in this? Is there something comparable to this that already exists, or was there just nothing?
Nothing. I mean,
Yeah.
it took me 40 years to get, not without lack of trying.
Of course. Yeah.
Right? But again, it's the same singular approach. And
Sure.
here's this. It's usually just, like, if you go to the walking clinic, it's usually just like some sort of medication, right? They're not
Yeah.
going to be like, you should investigate cognitive processing therapy
Yeah,
or
is there
something.
even the right people in place at the clinics that normally walk-ins would go into that would have that full knowledge to actually assess and go forward? Yeah.
Well, yeah. I mean, we're trying to help them,
Yeah. Yeah.
right?
And tell me about the name of the company. I found that really cool too. I kept saying it last night to myself to remind myself. How did you come up with the name?
Well, it's what I do to my kids and my cats, which
Yeah.
is just a boop on the nose.
Oh, boop. Boop.
It's
Okay.
just it's a kind of term of endearment, but it's not
Yeah.
like so.
Yeah.
Like, how you doing?
Yeah.
And my
yeah.
cats, I do it to my cats.
Yeah.
So, and I'm used to being the outsider, I suppose.
Sure.
And I didn't want to have like a brand that was
Yeah.
generic.
Yeah.
And it's just a way for the individual, because
Yeah.
that's the person doing
Yeah.
the assessment, is not going to be overwhelmed with, like, individuals can do it on their phone before
Yeah.
they arrive at an appointment, or they can do it with a doctor.
Yeah.
So I just wanted something that was somewhere approachable.
Beautiful.
Yeah.
And we're in a time right now, I should say we've been in a time where mental health has taken more attention because we gave it attention. We said, it is important to look at. I remember from the days when my parents were growing up, if I were to have a conversation with my parents about mental health, they'd be like, let's just keep going. Let's just keep going. Whereas now we need to understand that some of the things that allow us to like freeze in space or even just have a moment where we're having a tough time, that it needs to be acknowledged. And I feel like this is really important work.
I don't know, in the 80s, like, I grew up in a household, lovely people, but just, innate with,
Unaware. Yeah.
unaware, like, or just like seeking help or self-medication, like whatever it might be,
right.
in whatever foundation we had in 1985.
And nobody wanted to talk about things that were going on.
No.
It was almost like, oh, okay, Band-Aid, and we're out of here, or not even look at, let's not even talk about it, and then it'll disappear apparently, but that's not the case.
Yeah, I mean, if you had a giant rash on your face or something, somebody's be like, you probably should
Have that looked at.
have that looked at,
Yeah,
right?
that's right.
And whatever. But when it's in here, then it's just still, even though we've opened up the conversation, and we have, it's everybody's a champion for everything these days, right? So you have your mental health month, which we're in, I think.
Yeah, we'll talk about that.
It's harder to see, and the point being is that it shouldn't take, statistically, it's 11 years for the first onset of something. It shouldn't take 11 years to even, figure out what stop. Everybody just self-diagnoses.
Yeah.
Right? They even do it with physical stuff. So that rash on the face, they're going to be on
Let me
images and be like, oh, you have
That's right.
this and this.
So it being Mental Health Month, it's great that we have a month that we can acknowledge it, but I think mental health is affecting us all year round, 24 hours a day.
Yeah.
What are some of the things that people can think about this month and that they can take action on? Yeah.
Yeah, I think it's good. I'm not a big fan of the whatever, change your Instagram profile and all of those things.
The square,
Let's
for a day.
talk about it. Like, it's good because it brings awareness.
Sure.
But I think just from an individual perspective is to, you probably have somebody in your family
It's going through it.
It's going through
Absolutely. If it's not even you, if
it's not
somebody,
even you, it's like we all kind of deal with it.
Absolutely.
And look, there's things like everybody knows what trauma is or feeling, sad, but when it gets to the point of impacting someone's life, they're struggling with their work because of this. Everybody struggles with their work.
Absolutely. Absolutely.
But when the walls are closing in,
Yeah.
and it's recognizing that there might be more to the story. It's not just because this person is
Absolutely.
lazy or
Yeah.
can't get their shit together.
And that's such an old school mentality to pin that sort of diagnosis or assessment onto somebody, to say it's always them. It's not. It couldn't be anything else. And where that can't be the case, because it's so prevalent that people have mental health issues right now, and it's I remember during COVID, people talked about it all the time, but it was before there and it's after that. It's like it was always there, but it might have been heightened during those times as well. And now with what's going on in the world, people are getting triggered by so many different things, and I can only imagine.
Go back to COVID all of a sudden.
Yeah,
it highlights it because isolation
Yeah.
and doesn't necessarily help at all, but I mean, it just goes back, I don't know, I'm just going to go back to the rash on the face.
Absolutely, yeah.
Which is, okay, like, people now understand,
Yes.
like, you got to deal with
Yes,
that. Like,
yes.
maybe you don't have to, but you
Yes.
probably should. Whereas if it's in the backside of, your brain, then it's hard to articulate, and it's hard, the symptomatic outcome, it could be anger disorders, it could be, whatever coping mechanism it is to deal with any of those disorders, can be misinterpreted by the people around them as whatever. They're mean, they're protective,
Sure.
they're all these things, and the reality is that there's probably something driving it.
Is the assessment that you have created, is it based on scientific sort of? Can you tell me a bit about the building of that assessment? Yeah.
So we only use what any doctor would
Great.
use. So we use all of the kind of general paper intakes.
Sure.
We combine them, but instead of just filling out. So if you go in for anxiety disorder, I filled out a bunch of those.
Yeah, of course.
You're like, you're good.
Yeah.
Like you're part of
You're
the team.
clear. Yeah.
So, but what they often don't do is connect the dots.
Yes.
So what is causing the anxiety?
Yeah.
Right. We all know what anxiety is. But is there? So what we do is try to combine that all together.
Yeah.
But we only use what a doctor would use. What we add into it is the extra layer of convenience, for one, reporting.
Yeah, sure.
So if somebody's raising a grant for $500,000,
Yes.
There's increasing scrutiny on how's this working for the Lower East
What
Side,
is
or
it?
whatever
Sure.
it might be. And so we provide the visibility and in some cases accountability, but more so the opportunity to say what we're doing. This program is helping.
Wow.
And right now it's papers and spreadsheets, so
That's right. That get lost.
they get lost, but it's also the additional work that they don't need to do
Yes.
to say, this person's been here 4 times,
Yeah.
and
Let's not
I don't have enough time.
Yeah,
so
fill it out again and again. And so, how is it done through an app? And what is the interface for it? Yeah, can you describe that? Yeah.
the app is, you can do it on your phone.
Yeah, great.
You can do it on a tablet. You can do it on a desktop.
Yeah.
So it's just meant to be, somewhat less intrusive.
And it stays private. And then when you want to share it with your expert, do you bring that piece to them, or do they get it sent? How does it work? Yeah.
So right now it's the care providers that issue it.
Oh, great! Wow.
Right? And
That's
then
amazing.
the user, the client, the patient, whatever it is the one that accepts that relationship.
Wow.
And then they'll do their assessment.
It's amazing.
And we don't currently do individuals. Like, you can't just roll in
Sure.
and get one
Yeah,
because of complications. We
Yeah.
want to get there, but
But it needs to be a good starting point, which it is.
yeah.
And tell me about the adoption of this. How many people are using this right now, and practitioners and for their patients?
So today
Yeah.
is our launch day.
Congratulations. Yeah. Mental Health Month. Thank you for doing that, Jason. Yeah.
We have 7 pilots,
Yeah.
advisors, doctors, clinics using it, right now.
Just in Canada, is that right?
Yeah,
Great.
right now it's BC, Ontario, like one in Alberta. But so the whole point was to, kind of quantify our thesis,
Yeah.
which overwhelmingly they know it's messed up, right?
Yeah.
So those initial like pilot customers we continue to work with, and then as of today is a more open approach. So you can now get a demo if you're a clinic or a counselor or a center, versus what we had before, which was just a waiting list.
Can patients, when they go into a clinic, and I know because this is just a trial basis right now where people are just trying it, can they request this diagnosis, or can they say, hey, can you connect with HiBoop and can we do this at our clinic, or like what is the best way for us to allow people to access this? Because this, I believe, an assessment like this will change lives.
It will.
Yeah.
Emphatically. Or save years, right? Because that 11 years, if you look at some of the disorders, they don't have 11 years. But eventually individuals will be able to take it to their care provider and say, like, because everybody walks in with their WebMD printouts of the face.
Yeah,
like I have syphilis or something.
Absolutely. Their ChatGPT diagnosis of themselves. Yeah.
But because we're only using their science, this is not like, so it's just a way to accelerate it, and that's a way, I mean, at the end of the day, because we don't do the diagnosis, the doctor, the care provider can just validate it all, or just like start from the beginning saying, I'm not accepting this, and they're going to do the same questions.
Yeah, over and over again.
On a clipboard. So.
Wow, you've simplified it, you've made it easier for people to access. And these people, these doctors or assessors that are going to be putting this out there, I guess you're going to get a report back to see how it worked.
Yeah, I mean, the mission is overwhelmingly well received.
Absolutely. It's necessary.
The only roadblocks we hit is trying to articulate that we're not replacing, we're not building a robot platform to replace doctors and stuff. It's just more that, like, we spoke to a potential partner and they're like, the capacity is not the diagnosis, it's the assessment. That's why it takes a year.
Absolutely.
And which is crazy to me.
And do you find that these assessments are very accurate with the final sort of piece to the person who's assessing it? Like, would you say, like, oh yeah, these questions or these, and the answers that we're getting from these questions will definitely direct us towards a better assumption of what could be going on? Yeah.
Yeah, I mean, again, it's not like a blood test.
Yes.
It's based on decades of research to ask these questions to try to figure out what is going on, right? Depression looks exactly like this. Bipolar looks exactly like borderline.
Yes.
Right? Completely different treatment plans.
Yes,
One's
of course.
personality, one's inherited. ADHD looks like this, but so does ASD. So, I think we know we can help.
And would you say today the assessment is like this long, but as we get more science or more information, we can keep increasing the type of assessment that we offer?
That's up to like the DSM and the text that you would use. So if you go to UBC, you're gonna have this giant book.
Sure.
What we can do is to better inform. Because nobody's gonna do no individual is gonna do that giant book of assessments. So we can be like, don't look here. It's probably not a thing.
Sure.
Let's dig a bit here.
Wow.
Let's look a little bit here.
Wow.
Yeah, it's a bit arduous because you're answering questions.
Sure.
You don't know what you're in, but let's go through everything and almost eliminate as much as we can, and then we've got a broader picture. Whether that leads to diagnosis, so you can get your therapies or therapeutics or additional help, we can help inform it, and that's why it takes 11. Well, for my case, 40 years, right? I had no idea.
Wow. If you were to ask our audience today how they can help you, what would you ask for?
Oh, that's a good question. I think just compassion, understanding.
Yeah.
We're I'm not representing like a whole community here.
Sure. Yeah.
We're generally good at masking until, and this is part of the problem, until it hits crisis, right?
Yeah.
And so if you look at some of the treatment centers, the inpatient, outpatient, it's like we wait too long.
Yeah.
And sure, there's crisis intervention, there's triage, but it shouldn't take that long. So just be compassionate, or just be aware.
Love that.
Just somebody's seems they're fading from life or whatever, or just maybe think a little bit longer about what might be happening.
Yeah.
It's a real thing.
Can people, is there a website for this right now?
Yeah.
Can people look at the assessment at all? Or does it just go to from the practitioner to a patient?
It's up to the care provider.
Care provider.
When they want to send that, or when they want to, they will.
Yeah.
It's their data. But what we want to make sure is that if there's a high risk assessment and it's 2 weeks before they're going to see a care provider, we don't want to sound the alarms to the individual. We want to
Get them care.
escalate that with the care provider.
If there's a care provider then watching this, what would you ask them?
Just go to the I don't know what. Go to the website and the most progressive professionals are the ones that we've engaged with, right?
Amazing. Yeah.
So we're not here selling personal assessments. It's not a personality quiz.
No.
It's the care providers that, at least in this group, this early group, that understand that it is imperfect. And what we've built is imperfect, but it's better.
Yeah.
Right?
And it'll keep getting better.
Absolutely.
Yeah.
The more data, the more we can kind of reroute people and referrals. Because part of the problem is, doctors, or if you look at Island Health or something, they're like, we don't do ADHD assessments because we don't have the resources to deal with it. And I'm like, well, that's.
Then who does?
Right? You can still assess it and say, here's your referral, right? We're going to deal with this thing.
Absolutely.
You've come in for this, for anxiety and ADHD or best friends. They're like, well, we don't have the resources. But that human should know that they're, sitting within this profile.
Yes.
And then what we do is help connect all the dots. If you're ADHD or ASD, okay, these things you're predisposed to.
Yeah. I think the biggest thing in society now, especially in 2025, is that we do have access to information.
Yeah.
And we have access to opportunity to advance that information to get help. And what you're doing is creating an opportunity for people who are suffering from mental health issues or diagnoses that they don't know about to go to a care professional and get that properly assessed. So
that's the big one.
First of all, thank you for doing that.
Yeah, that's the big one, is the unknown.
Yeah, the unknown. And we're all living in unknowns.
We're all living in unknowns, and when something gets to a point, like for me, it's, they were like, you have ADHD, you have complex trauma, you have
things we might not have even
generalized
heard
anxiety.
about. Yeah.
And I'm like, God damn, that took a long time. And
and there's enough information out there because people are, like we said, assessing themselves, going online and taking check if you have ADHD and fill out these 10 questions.
Yeah.
And I'm sure it's deeper than that. I'm sure there's a lot more that you need to assess. And if you have a proper researched questionnaire, which you're working on, which you've created, that can be accessed by care professionals, then that marriage is quite beautiful, and there's an opportunity there to heal, to get the care that you need. And this was inevitable that this needed to happen.
It is, and there's really nobody doing it well. outside of the amazing care providers, doctors who are trying, to do what they can with students rolling in with anxiety
Absolutely.
or compulsion or whatever it might be. So yeah, that's the...
I think it's beautiful. And as it is Mental Health Month right now, we're constantly thinking about what are we going through, and we should also be thinking what our neighbors are going through, what our friends are going through, and then what is the opportunity to help those people. And what you've done is you've taken a wide approach through using technology, assessment, and then also putting the care providers in charge of this kind of stuff as well. Because usually, sometimes people are like, oh, I'm going to take it in my own hands, and then nobody's listening. But when you give opportunity to a care provider to say, oh, this is something that we're going to offer to the public or to our patient population, then there's something that can be activated. And I want to thank you for that.
Yeah. And just on the end of that, I'll bookend it with that. It's the people in your lives that don't understand why they're failing, and everybody else seems, to, be able to be an adult and do the adult things. And so the shame and the, that misunderstanding is just like, geez, God, I don't, okay, tomorrow's a new day kind of thing. When those, not always, can be connected to something that is treatable.
Yeah.
And sure, you can do yoga and play pickleball or, all of the basic things are, eat well, all that. But there is a path that maybe gives you guidance to a better outcome.
And hope.
Hope, yeah. I mean, clarity.
Yeah.
I mean, like for me, it was like, oh, all right, this makes sense.
Having a name to attach to something that's going on with you rather than assuming I don't know what's going on.
Nobody wants all the labels.
Yeah.
Like I embrace them, but that's just me. Nobody. But there's both a grieving and an acceptance process within that. You're like, okay, this is why I miss all the planes or something.
I just want to acknowledge how powerful it is.
Yeah.
The work that you're doing.
Thank you.
And it's so necessary, and I appreciate it. If you want to learn more about Jason's work, you go to HiBoop, and you can Google that. Is it hiboop.com?
HiBoop.
HiBoop.com or .com.
Yeah.
Thank you so much, Jason, for being on the Human Biography podcast. I appreciate it.
Me as well. Thank you.
See you all soon.